All right, well, appreciate the efforts to promote everyone here to co-panelists. I know it'll take just a minute to make sure everyone's video is able to be turned on. But recognizing we're a couple minutes after 2, why don't we go ahead and get started? I'll be happy to kick us off with some opening hellos and just a huge amount of appreciation from
portal.
I think we're getting some feedback here. If folks are not speaking, if you wouldn't mind muting your lines, that would be really helpful. So hi everyone, Lisa Olson. I'm the Assistant Deputy Secretary now for the Department of Health Services. It's really nice to see many of you today. It has been a little while since we have convened formally our full OCI DHS Advisory Council team. So I want to start by acknowledging that and for thanking everyone for the tremendous effort that has continued in the background despite us not having an opportunity to pull this full group together. I'm really excited to hear about the continued progress from each of the work groups and how we really begin in earnest to think about and put our muscle behind the next open enrollment period amidst ever complicating circumstances. As I know folks are aware, DHS has really been leading alongside our partners in the governor's office, Wisconsin Emergency Management, the Wisconsin National Guard, and really all of state government in our overall COVID response efforts. Partners like you all, our healthcare partners, our health insurance partners, have been just doing a tremendous amount of work to reconfigure how healthcare services are delivered, how those services are covered, to make sure that we've got the flexibility and to be able to provide care via telehealth. It's just been a really tremendous effort from everyone across the board, and not to mention the amount of work that goes into making sure that folks are aware that all of those things are available to them. It's an incredible amount of consumer outreach and education and ongoing support services. I think one of the things that we know about COVID and about how the virus behaves is that it really does target essential workers. It targets low-income communities. It targets people of color in a way that has really highlighted the disparities that have existed in our system for a long time. And so it is really reinforcing more than ever the importance of this work, the importance of our partnerships in making sure that we are approaching both our response to COVID, our work to make our eligibility systems more accessible, our work to make sure that folks have the support and the tools and the healthcare and the coverage that they need in order to maintain their health. That much more important every single day. So I want to again appreciate everyone for continuing to do the good work in this space, and I look forward to hearing more from you all today about what that's been looking like. And I want to also recognize briefly Olivia Wong from the Department of Administration, formerly from the Office of the Commissioner of Insurance, for her ongoing support despite her redeployment to DOA, and congratulate her on that new position. But thank you, Liv, for continuing to move this work forward as well, and welcome Kelsey and others from OCI who are going to be leading this work from the Insurance Commissioner's standpoint. So with that, I will end my opening spiel and turn it over back to Kelsey to continue our agenda for today. Or Liv.
Thank you, Lisa. And I think, so I'll keep my comments brief so we can keep the agenda moving. I want to say, please bear with me with my muffled voice today a little bit. Really first, all of the things that Lisa pointed out, I think are really important in terms of thanking everyone for their ongoing commitment to this. I think one of the things that, I want to say too in my role now at the Department of Administration is that one of the things that has been really reassuring in this transition is the DOA Secretary's permission to me to sort of continue to participate in the collaborative nature of this work between different state agencies as we work to make sure that individuals have access to health care and healthcare coverage. It continues to be a priority for the administration, and I think that the continued participation in this group is really indicative of that. Along those lines, I want to point out too that Noah Roberts, who is the governor's policy advisor who works specifically on healthcare issues, is going to be joining us this afternoon and has talked about engaging more in this group as a mechanism for staying really engaged in this process. And so if he's not already here, he will be here shortly. He was wrapping something up. But I'm grateful that the governor's office is continuing to be engaged in this process. And I think that we'll see that as we move into the fall and are preparing for open enrollment activities. I really also want to take a moment to just point out all of the work that the work groups have done, and I know that we're going to hear from those work groups this afternoon, but it's really worth pointing out, I think, that this group was really started with kind of one purpose, and I think that's something that we'll talk about today in terms of where we should be focusing our efforts, where this group should be focusing its efforts. But I think one thing that's worth noting is that when the pandemic started, many of the work groups retooled their directive essentially to make sure that they were addressing ongoing issues pertaining to individuals needing access to healthcare coverage during the pandemic. And I really want to applaud the work groups for doing that everywhere from the workforce capacity work group to the marketing work group, which worked on resources for individuals who were losing their health insurance as a result of losing their jobs. The work that the data work group has done in order to help sort of stand up a tool and in process of standing up a tool to sort of identify where there might be need. All of this work was really, to a certain extent, related to the council, but really expanded. And I want to just sort of applaud the work group members for all of the things that they have been doing over the last several months. Ooh, you can see the lightning at the side, the corner. And I'm incredibly grateful to everyone on those groups who's done this work, despite the fact that you have a million other things on your plates and your organizations are also dealing with the pandemic. And it's really commendable. I also want to let you guys know that I do plan to stay engaged in this new role, and I'm very excited to continue to try and bring more people to the table as we talk about this, whether that's other organizations, other state organizations, or other entities that are outside of state government to continue to have this conversation. So I'll let Kelsey keep us moving through the agenda, but I'm grateful to be here today and for all of the work that everyone has been doing over the last several months.
Thank you, Olivia. All right, so we can start moving into the work group reports and presentations, starting with workforce and capacity. So you should have access to share your screen if you'd like to take that over.
Okay.
Thanks, Bobby.
Yeah. I want to talk a little bit about the workforce and capacity work group. This has been an effort that started really last year when we began meeting ahead of open enrollment, thinking about issues that we wanted to address, not only for open enrollment, but looking at a bigger picture of issues throughout the year. The work group has spent a fair amount of time taking an inventory and assessment of, what exists out there, what resources we can build upon, both from a client services capacity and a consumer assistance capacity, as well as a training capacity. Let me address some of the initial elements that we looked at from a consumer assistance. We had guests come in from the ADRC network, both for seniors and for disability band specs, to really give us some background on the nature of that sort of consumer assistance that's available. I mean, one of the things that we really think is important is that if we think about building a system for the consumers we're worried about in terms of access to healthcare coverage, marketplace, Badger Care Plus, and other services, that we're not redundant to some of the other systems that exist out there. So we've learned a little bit about their process, their training, their supportive services, the legal backups that they have available to them, and the level of services that they provide. I think it's really important when we think about building systems of consumer assistance for folks out there, that we think about the folks that are already doing it, and how do we build capacity and support for those gaps that exist. We know right now that we have, Covering Wisconsin is funded with navigator services. There's CACs at some of the hospitals, and some of the community-based organizations, but that capacity, that infrastructure is severely limited in some ways by the Trump administration. The state helped out to strengthen it, but we're really concerned, I think, at a point where we see stressors on the system. Early on in our process, we pivoted quite quickly to looking at COVID and thinking about how are we going to address some of the issues related to COVID. People that were losing coverage through loss of employment, people that were losing coverage because of loss of income, people that were losing coverage because of just illness and things like that. So we really tried to address and adapt to some of those and work with our colleagues on the data work group and the outreach and marketing work group. We contributed some to the Get Covered Wisconsin website, and so that was some important elements that we contributed to. We had some partnerships with veteran service officers, thinking about veterans and addressing how veterans are involved in this. And we know we have veteran service officers across the state in every county. And again, not wanting to be redundant to those systems, but how do we build an infrastructure together with them? We had some valuable tips and strategies from veteran service officers about how to reach and provide assistance to veterans, their spouses, their families, and others. And that is all going to be a part of some of the recommendations that we developed. I think the key takeaway from the consumer assistance piece is build upon what we have, make sure that we're working in coordination with the other resources, try and make sure that we have a system that is not, duplicating, and we have a good referral system. One of the areas that we spent a fair amount of time on was thinking about the point of contact. And Allison raised some good points about 211 as being a resource that is used, but may not be precise enough for some of the services that we need for sort of a consumer assistance or client assistance. The 211 is really very broad-based, and sometimes you lose the opportunities for a warm handoff that we know in this business is really important to make that connection to the program, especially for vulnerable populations, people that are affected negatively by health disparities, low income, poverty, English as a second language. Those folks are the most at risk of not making a good transition into the services that they need and deserve. So thinking about ways that we could build a hub or a statewide link for support for people to do that intake, to identify resources, to get them to the right person, maybe to the veteran service officer if it's a veteran, obviously to the ADRC if they're over age 60 or if they have a disability, but trying to complement and work within those networks and find that takeaway for the information that you're collecting and getting them to the right place quickly. And it's something that's probably beyond the scope and capacity of 211. The second part of the work group is looking at workforce capacity, teaching and training. We were very concerned about the opportunity to train new people. This environment makes it challenging to begin with, and we think about bringing new people on board and new employees and new training. Trying to do a competency-based approach where we can look at doing an assessment of the level of competency they have across different domains of learning, which could include private health insurance, including the marketplace, Medicaid and Badger Care, and then the skills. It's not just a plug and play system where you can just recite a program and get people connected. It's also the cultural competence, the understanding, dealing with folks that may have stresses, mental illness, racism that's impacting them, medical debt. There's other parts of it that really go into the counseling and the client assistance piece of it for the training. So we talked quite a bit, and we learned from some of our colleagues in other areas about the teaching and training that they do, how we could build remote learning systems to assess competency and capacity. Again, building upon some of the systems that exist already from OCI and the licensing of navigators, the federal licensing of navigators and CACs, using those to complement some other teaching and training resources, again, to build capacity, to build competency, to maintain continuing education, to support folks through the process. So in sum, there's the one piece of the client assistance to actually get the assistance out, learn who the people are, help them, but also building the teaching and training so we can build a system of strong support and patient advocacy for those folks that need it. Allison, I don't know if there's anything you want to add to that.
No, thanks so much, Bobby. That was a really good summary of all the work that we're doing and continue to do in this group to try it, as exactly as Bobby said, really recognizing all the tremendous work that is currently happening among organizations, and how can we be better coordinated, connecting people to those resources in the most efficient way without dropping off, without people losing their path. But we can talk more about that, and I know that we want to continue with the other work groups.
Great, thank you so much for the update on that, Bobby. We can move into data here.
Great, thanks, Kelsey.
Melissa, thanks.
I'm gonna try to share my screen and see if that works. Can everybody see that?
We can.
Great. Hopefully I can advance it too. Maybe that's going to be more of a challenge than anything. You're not seeing new slides, are you? Okay.
Not yet.
Oh, I guess I just have to click it. How's that? So I'll start by introducing the members of our work group, which includes a great bunch of people who are really committed to this cause that we've been talking about. So we've got active participation from many different individuals and some great support from state agencies. So thank you so much for everyone who's listed here for all the work that you've been doing to move our purpose forward. And we have defined our purpose and scope for this work group. So I wanted to share that with everybody. And this is what we've put forward and approved by our work group as our purpose and scope. So really what we want to do on the data work group is to make sure that we're measuring key goals and moving toward public accountability for the work that we're all doing. And so what we plan to do is define KPIs and create a dashboard that is going to help stakeholders visualize and evaluate progress. And so this work that this part of our purpose is really just beginning, but we should expect in the future to see some recommendations related to that come to the advisory council. We also are very interested in supporting process improvement and policy development. So trying to identify inventory and identify gaps in data and make recommendations to the work group on how we can fill the gaps, and then translate data that we do have and that we can get our hands on to make sure that it's accessible and understandable by those who are using it. And then finally, we're looking to educate our stakeholders and really support the other work groups. So we see the data work group as being in a supportive role for the other work groups to help them accomplish their goals. So these are the deliverables that we have identified: a Tableau-based data dashboard that would be interactive to meet the needs of various stakeholders. And we are very fortunate that we have the active participation from Joe LeDuc at OCI, who is a Tableau wizard and has really been able to help us start this work and really visualize data in a way that that is really accessible to people. So we're looking forward to getting that into a model that you guys can all look at. And then we are also, as I mentioned already, doing an inventory of all the information and resources, and then a gap analysis to go along with that. And then those recommendations that I mentioned in my last slide. And then the KPIs and data sets that more efficiently and effectively target individuals. So those are really the deliverables that we've identified that we would like to get done in our work group over time. As Olivia and others have mentioned, we of course started our work and then immediately kind of got hit with COVID-19. Well, not ourselves personally, hopefully, but the state of Wisconsin did. And so we very quickly transitioned to trying to find ways to help support everyone who is working in that space with data. And so on April 27th, the work group approved a recommendation that we sent over to OCI and DHS, since we were kind of in between quarterly meetings, that we called a COVID-19 Rapid Response Dashboard. And our idea was to try and collect data from Medicaid, bump it up against marketplace data, which wasn't being collected on a regular basis and still isn't actually, and then and match that up with unemployment data so we could identify hotspots where we think enrollment outreach is needed. And so this work has been underway and is currently underway, and a lot of work is currently being done by both DHS and OCI and our work group to really present something to everybody on that. So what this requires, of course, is the active participation by OCI and DHS, a commitment by our work group members to make the data usable and accessible, and then a commitment by advocacy organizations to use the data. That is very exciting for us, and we hope to have something to show you very soon. So then just looking ahead, wanted to give you a flavor for what we're going to be doing. We really have this idea of a one-stop shop dashboard in mind, where you could go out, anyone in the state of Wisconsin could go out and see kind of the status of coverage and things like trends and so on. And so that is something that we expect you to be able to see in the future. And then obviously we have work to do in filling gaps in data. And I don't expect that to move quickly, but we already know many areas where we're going to have to do a lot more work to try and understand coverage in Wisconsin and where people are falling through the cracks. We are also really looking forward to trying to create some more targeted lists or data sets that advocacy organizations can use to really use their resources effectively. And then we're going to be defining goals and establishing those KPIs that I mentioned. And so right now, what we are working on is creating 3 different tracks for our work group. As you saw on the membership page, we have quite a large group, and we meet every 3 weeks. And what we kind of started thinking about as we were organizing our work is that maybe it would be best to organize into 3 different tracks and have members of our work group really focused on those 3 different tracks and kind of separating into subgroups. So that is what we're working on right now. And you can expect some good things from us by the next quarterly meeting. I don't know if anyone else from the work group wants to add anything.
All right, thank you so much for that update,
All right, thanks, Kelsey.
Melissa.
Mhm.
All right, next up, we've got outreach.
Hey, this is Adam. Sorry if I look a little harried. When the storm started, I had several pets start to panic, and I had to deal with that. But I was listening to everything, and I really appreciate the other work group coordinators' updates. I will try to keep mine a little bit shorter, as I don't have a presentation PowerPoint to go with it, and I am watching the clock and know we have a lot to get to. We have, like the other work groups, and as Olivia said, really shifted our focus because of COVID. We had originally kind of outlined a plan very early on of, the different groups we wanted to participate in our work group, and then the different populations throughout the state we really wanted to do outreach and education to. And that all shifted with COVID. And since the early spring, we've been meeting bi-weekly, trying to identify these groups, these populations we want to reach out to, and really refine our messaging. But along the way, a couple other things have kind of spawned out of our discussions, including tracking the different changing topics related to COVID, whether that's, the pandemic unemployment assistance and all of the different ways that's counted, or the Badger Care Plus policies or food share policies changing, and different things that assisters and other people who are helping folks connect to health insurance throughout the state really need to know. So we helped promote a few trainings, and several of our work group members participated in presenting those trainings to assisters throughout the state, which were really well represented. And from there, we have been focusing on a few different issues. We've decided the dislocated worker population is really, it's incredibly broad, but we know that it's heavily affected. And through our discussions, we just know that the call volume and the need is, the call volume is not high enough to represent the need that we know is out there in the state related to insurance. So we've really been brainstorming and trying to get messaging out to those groups. And to that end, we worked with the other work groups. So we actually just started collaborating with the promotions and marketing work group, and are going to put some messaging out. We've identified and started conversations with the Restaurant Association, the Wisconsin Tavern League, the Hotel and Lodging Association, and have just kind of been working our way service industry by service industry. And I know the promotions and marketing work group has even more for us to reach out to. And the casinos as well. We know that a lot of people, we've been kind of waiting for the moment when people lose insurance, and are really trying to get our messaging out to make sure people don't miss special enrollment periods, make sure people know to hop on Badger Care, sometimes even before unemployment starts, just to make sure they kind of locked in based on the policy changes. So we've been doing all of that and coordinating. And now we've also shifted focus slightly to include back to school, and are also really preparing now we're discussing open enrollment, what that needs to look like, what kind of buy-in we need from DHS and OCI, and really how this work group can best help with that and help roll that out. The messaging we've included has gotten people referred back to WIS covered, so that's been really great. Likewise, we've used the capacity work group's environmental scan and have been adding to that. I already mentioned collaboration with the promotions and marketing work group, and we are really excited for what the data work group is going to roll out. So I'm definitely looking forward to that. I think that will be instrumental in furthering this work. And beyond that, I just keep looking for people to add to the work group. I realized we had a gap representing Milwaukee. So I was like, okay, we need to get more Milwaukee organizations. This really should be representative of the state. So we know we're getting voices from all over, and we're able to identify the different populations, whether they're consumers, just the regular populace, or the professionals we need to do outreach to. So the work continues rolling forward like that. Any questions, or any of the work group members that I think I've got a couple on want to add to that? Great, that is it for me.
Great, thank you, Adam. All right, we can move into the marketing work group now, which will be myself and Stephanie. So, Steph, I'm not sure if you wanted to pull it up on your screen since you have, you're on mute right now. I can't hear you.
I am not really proficient in toggling back and forth between Zoom and PowerPoint, so I'll let you pull it up.
Okay. All right, can everyone see that?
Yes.
We can, thank you.
Sounds good. All right.
Okay, so our really short, we decided we needed some visuals since we're talking about visual assets that we've created. So really quickly, we're gonna backtrack a little bit and talk about some of the communications that were created that were related to the pandemic and the loss of coverage or where to go for help. And then some of the steps we're moving into to plan for open enrollment messaging. So in the past, or up until now, we really had a heavy focus on what are those insurance options during COVID-19, where to get help. We really focused on social media messaging. The WISC covered website was created, and I'll let Kelsey talk about that in just a moment. And then we also created a series of mailers. And so that was the whole idea from the concept to the actualization. And everything was a focus on how do we reach some of our vulnerable populations? Because we know that social media is not going to reach everyone. And so we were trying to dig in a little bit. We know a lot of our community groups are not actively in the communities. And so how do we reach those vulnerable populations? How do we reach anyone at this moment? And just really digging in. And there was some research done, and we looked at some other states who have been successful to get people to enroll. So we were trying to pattern some of our ideas after that. So a lot of the social media messaging was a focus on the coverage that may have been lost. And we had a mix of both graphics, so that's like a static, just a post with a picture, videos and GIFs. So creating some movement and increasing people's interest in the content. And then I don't know, Kelsey, if you want to talk about how there was some cross-governmental reposting of content.
Absolutely. The governor's page has been sharing quite a bit of our health insurance posts. And we had also put together a video with Lieutenant Governor for the launch of WISC Covered. So that got a lot of traction as well, which leads me into talking about the WISCcovered.com website that we put together in the marketing promotions work group. That was launched towards the end of June, and basically connects folks in need of health insurance with experts like those at Covering Wisconsin, the Medigap Helpline, and 211. And it's available in English, Spanish, and Hmong. So I've got kind of screenshots there. It's designed to work best on smartphones for Wisconsinites who may not have access to a computer or lack access at home. So focusing on folks in rural areas. And it was a good thing that we went with the mobile first design, since almost 60% of our page views since launch have been accessed on a phone or a tablet. Yep, like I mentioned, we had put together the PSA video with Lieutenant Governor Barnes to help announce the launch. All of our social media graphics have been designed in English, Spanish, and Hmong versions. And we've had almost 5,000 page views since the launch at the end of June, so that's pretty good. And a lot of click-throughs from our site to either Covering Wisconsin's online connector tool. People are heading over to healthcare.gov, accesswisconsin.gov, and a lot of people are clicking through to the phone numbers that we have listed as well. So it is definitely doing its job of allowing folks to find the information that they need to get connected with.
And if I could add, one of the reasons why the site was developed, and Olivia can always jump in if I don't speak exactly correctly. So is that when you try to tell people about your insurance options, there's just too much content for social media. It's really a lot. And really at this point, there's so much going on. People have varying things they might be eligible for. It's really hard for people to try to figure out which door they should go in order to sign up or learn more about health insurance. And so it was to create a little bit of interest. They might click on something, and then it's a website to sort of direct where they might call, what might be most appropriate, and answer some questions.
Absolutely. Thank you for that explanation, Steph. So we will be updating the site for open enrollment. We'll need to be changing content out for the pre-open enrollment period, during open enrollment, and then post-open enrollment. We'll be continuing with the English, Spanish, and Hmong translated social graphics and web pages. And messaging and the timeline planning is currently underway. So we'll be discussing that more during our upcoming meeting here this week.
Okay, so now that we're starting to approach getting close to open enrollment planning, we have really started to shift gears. And something that we think is really critical in this really confusing time of pandemic and we've got elections, there's a lot going on. We think that a statewide effort is really the best bet. And another thing that we're really worried about is how to reach people. Again, not everyone's on social media. Even if you have internet access, not everyone is reading social media news. And so we've got to find ways of reaching some of those really vulnerable communities who may not be reached otherwise. And so our group is really recommending a statewide public service announcement style campaign for both radio and television. And actually it does also include a social media component. And what's great about that social media component is you can get a lot more views because it's each individual radio and television station posts the link. So this is something that's through the Wisconsin Broadcasters Association, and it's actually really affordable when you consider what you get. And let me just put a little bit of information out there. So for example, when you purchase 1 week, which is $9,500, you get 13 state TV stations in Milwaukee, 19 radio stations in Milwaukee. In Madison, you would get 7 TV stations and 15 radio stations. And so this is really a way to more broadly reach a wider audience. And so we really think this is the key way to go. Because at least since people are not actively going out into the community and accessing all those various community organizations or other places where they might learn about health insurance options, you know, maybe they're watching TV, maybe they're listening to the radio. And we do know that the radio is quite popular in certain communities who are the most vulnerable at this moment, especially as we're thinking about social justice and health equity. So we really think that's the way to go. However, we're also hoping we can make it a statewide effort to try to get some funding to help us make this happen. So we're starting to reach out to various stakeholders to see if they'd be interested in chipping in some dollars. So we could really use everyone's help to sort of help us spread the word, or if you're from one of those stakeholder groups who often invest money in advertising every year, this is pretty affordable considering the reach. And we also think it's important in the statewide effort, like we're really drilling down on that messaging. The messaging will be the same, and it's not going to be confusing lots of different messaging coming at people from various different sources. So really just working within the work group with stakeholders to design the messaging, keep it simple, and have the call to action be really simple as well. In a lot of social media venues, that will be clicking to the WisCovered website. And we're still working on what will the phone number be that we direct people to call. And so that's one of the questions, where is 211 really the best site? If I call there, it's just I have to call yet another number to reach someone else. And so that's something that is really heavily going to impact marketing and communications for open enrollment. So hopefully, as all the groups are communicating and talking, we can get some planning going around this and how we're going to, as a state, really focus our communications of where people need to call. In addition, we created some mailers. So in addition to these efforts and things that we're recommending, we did create some mailers, and these can be mailed. For example, we created several different images and for different communities, and even a little bit of the different messaging. For example, we know that in more rural areas, affordable is a really important word to use, whereas in more urban environments, we're going free or low cost. And part of that's based on market research that was done during the Affordable Care Act, what people really respond to. And so we've got, the mailers are ready. We're really trying to target people and target zip codes and what message might be the most meaningful. You know, if you've got a zip code with a lot of people who are in that maybe close to retirement age, we might target them with a lost your job or want to retire early message. If we have a lot of single person households and they don't tend to be closer to the retirement age or closer to the Medicare age, then maybe we just say lost your job. So we are piloting this now. We're hoping to get those sent off really soon. And based on the numbers and the response we get, we'll decide if we're gonna roll something larger out during open enrollment. And I just wanna say that this was something that was also conceptualized with the work group, and the messaging was tinkered with. So it was really a lot of great stakeholder group participation. Lastly, is it lastly? Because Adam already mentioned that we've been working with the education and outreach group, but the last thing that we think is really important is that DHS really do a statewide campaign affirming that public benefits are there for you and to help people get through this tough time. We think it would be really valuable to help improve the perception of public benefits. And it's the moment, and we hope that it's possible. The work group is happy to give feedback on ideas, but we really think it's the moment. And we think that the best way to do it is not to give too much information, just that it's here, and you sort of like design it like the WisCovered website. You click to another site where there's more information and you can piecemeal what might most fit your situation. But just get that interest, get people to click. If it's a social media campaign, there may not be many dollars for a whole public service announcement campaign, but we do think now's the moment. So anything to add, Kelsey?
I don't think so.
And I'll just mention that all of the work groups over the past quarter, especially, but even prior to that, have been periodically coming together to make sure that we're all working in coordination with one another, to share what we're working on, what we're learning, stumbling blocks, questions, but really just making sure that this is not the silos of the work groups, but that the work groups also are working in conjunction.
I cannot seem to get back here.
Question about the PSAs. Are those going to be branded as DHS, OCI, State of Wisconsin PSA messages to the residents of Wisconsin?
Yeah, we're still working on that. One of the examples that was shared to us from the Wisconsin Broadcasters Association, for example, it's very easy on TV. At the very end, you can have just a screen with everyone's logos of who was a part of the campaign. And we think that's ideal for the TV version, because then various stakeholders, you know, might want to really draw attention to the fact that they participated in funding a campaign. But in radio, it's more challenging. They have to read who the sponsor is on the air, and it takes away from your segment time. And as radio, you only have 15, 30, and 60 seconds if you have to read through a bunch of various different funders, it's going to really cut down on your message time. So we're not quite sure yet how we're going to handle that. It's something that's actually on our agenda for our meeting on Wednesday. But ideally, if we can come up with a way to say it was a collaborative effort, that would be ideal. But again, we're not sure.
This is Olivia. One thing I do want to point out is one of the things that was done on the Was Covered website is, since there were so many organizations that participated in the formation of that website and reviewing the content and giving input, was all of those organizations that were on that marketing group were listed and their logos were on that website. So it's clear that even though, you know, technically on the Was Covered, it says it's an initiative of the Wisconsin Office of the Commissioner of Insurance, all of the participating organizations have their logos and websites linked from that as well. And so certainly I think, you know, as these groups, as the partnership work groups start to continue these conversations, that's a place to really think about how to sort of bring everybody together. I do think to the point that Stephanie made earlier, and Kelsey as well, is really this cohesive message, this unified message as much as possible, the consistency across that. And I know that, you know, there's an agenda item later to talk about open enrollment a little bit more specifically, but the more that we can all be speaking with the same voice, the more effective that message will be, particularly as folks are really overloaded with so many other competing messages this fall.
Yeah, I think it's awesome that that the Wisconsin is getting this, and I just think it's wonderful when we can get the clear imprimatur of the state out front and say, this is, you know, the state of Wisconsin is saying, you know, these are the messages of the state of Wisconsin, and not just, I mean, advocacy groups, wonderful, everyone is doing great work, but now finally we're all pulled together and the state of Wisconsin is saying, yes, this is what this is the legitimate course for our residents. And then I had one other question. I don't mean to belabor this, but I remember back, maybe it was the last time this group met, there was some discussion about whether we could get some direct communications through DWD for people who were experiencing furloughs or layoffs or what have you, and, you know, on their website or some other way. Has there been any advancement in that arena?
So I'll jump in for this one a little bit too. Yes, there has been a little bit. And I will say one of the guides that OCI put together, which is a guide for individuals who've lost their health coverage as a result of losing their job, there is that information on the DWD website. I will admit that if I were a consumer looking for that information, or say I wasn't looking for that information, but it was relevant to me as a consumer, it might be a little tricky to find at this moment. And I think that those are conversations that I know Lisa and I had a conversation recently where we talked a little bit about this, and that continues to be, as we think about how the state partners together collaborate on sharing messaging that's relevant to help get people covered. That's something we want to continue to work on and try and make better. I don't know, Lisa, if you have anything else to add.
Less specific to the DWD front, but on your earlier comments, Donna, about having really a state branded, as it were, messaging campaign, I think is absolutely something that we are interested in moving forward, and have been actively participating with this group. I think there's still a couple of details that folks are still working through, but I agree, and I think it's something that we want to support.
Yeah, thank you.
Did anyone else have any other questions for the work group members? All right. Well, we can jump into revisiting the role of work groups. Bobby, would you like to?
Sure. Yeah, thank you. Well, it was nice to hear the reports from the work group and also the commitment that people have expressed to, working together, and Lisa's comments just there that that's something that's definitely part of a state agenda to move forward on communicating some of these issues. I think it's really going to be important. I think when we reflect back about when the work group were originally formed, it had a pretty significant focus on open enrollment, getting ready for open enrollment, getting people pulled together for open enrollment, making sure the state had a coordinated response when some of the Trump administration dollars were being pulled back. And I think we did. We had that focus for that open enrollment period. We had, people pulling together around those issues. We all reflected, I think, at that time that there was also opportunities to think more broadly than just open enrollment, that there are events that occur over the course of the year that require people to lean on the marketplace, to lean on Badger Care Plus, to lean on other programs that might be available. I don't think any of us realized that, COVID-19 was right around the corner. And in some ways, it was very fortunate that we had such a talented group of people already assembled for this effort. We were around and we were able to pivot pretty quickly to some of those issues. And I think it's, when we look at that original purpose and the evolving nature of our work, it's important that we recognize that, that we have tremendous capacity to do more, I think, out there for people that are struggling with connections to healthcare coverage. We know that, as Adam reported, the call volume was down. I think that, the marketing efforts are getting better. I think getting the state, the department behind us, to make sure that we have that commitment and that people are aware, because part of it is just, repetition and reinforcement of some of these issues for people. I think we have concerns moving forward. We have even greater issues that are confronting us. It's not just COVID-19 and the next phases of the pandemic, but it's racial and social justice issues that we need to address. We know that some of the most vulnerable groups that are part of the state of Wisconsin have the greatest challenges in connecting to services, fluctuating income, medical debt, barriers to access, confusing programs, and all the systems that are out there that we really need to be thinking about to streamline and facilitate better communications. I was really, pleased when we were working with the data work group, recognition that some of the key areas that we see gaps in coverage, and how can we gather data on some of those gaps in coverage, how important programs like Gap Filler in the state of Wisconsin can really help people that have fluctuating income. So, part of this, for the whole group, I think, is to be thinking about, the purpose of the group when we were formed, the evolving nature of responding to COVID, thinking, what we don't want to do is lose the focus on open enrollment. We're there again. I mean, it's really obviously a key point of emphasis. But so is, back to school. So is, people that, when something like COVID happens and incomes drop more dramatically, and employment drops more dramatically since the Great Depression, we're around to respond and address those issues. So, from my perspective, I think it's important to reflect back on, the role of the work groups, and then thinking about the current activities and how we've evolved, and how we can continue to address current and emerging needs as we move forward, because they will continue to emerge and they will continue to evolve in ways that are challenging for us. But underpinning it all, I think, is just making sure we have the commitment of folks from the state behind us, and the good folks that are part of this work group helping to lead the charge forward. And I think, we want to just have some discussion on some of these issues as we move forward, and thinking through, the role of the work groups, the role of this committee. As I hear the thunder rolling behind me.
Thanks, Bobby, I think that was really salient and good. And I too am so thankful that we have the support of DHS and OCI. I do want to raise an issue that we've seen and I've heard and observed in other work is that, especially now, it's probably important that we do some testing of messaging, and maybe that was inherent in this conversation and everybody assumed that would happen. I think we're seeing that not all people trust messages from government, and that what part of government it comes from can be important. And also, sometimes there's better ways to push out messaging to various communities. And so I just want to make sure on a campaign like this to be successful that there's some audience testing first before a lot of time and money is spent pushing a campaign that may not be received well, either in particular communities or broadly, kind of given the state of what we know about messaging that's coming out from government, especially now.
Yeah, thank you for that, Shannon. I think that's really important. I know that for the work that we do at ABC for Health, like for the Spanish-speaking community, trust is so important. And so much of the clients that come to us are word of mouth. And the word of mouth, especially in low-income communities too, it's important for all communities, but I think it's building upon that trust, those trusted relationships, and the trusted people in communities that can help be, it's part of the mobilizers of the message. Thanks for that.
Yeah, and Shannon, I think that probably Stephanie and Olivia could speak more specifically to the promotions work group and that work, but I think that's always a really important point. I think, looking at this example of having a statewide campaign, it's definitely not to, it's to augment, knowing that, you need to message in so many different ways all the time, never knowing which message is going to stick, and also knowing that it takes many repeated communications for somebody to hear it. So for sure, I think some people will respond positively to DHS or OCI or a collective, whereas others would be more positive to a community-based organization.
Allison, that's such a great point. And I just want to say one thing, which is that I know even in the development of WIScovered.com, one of the key considerations, and I know Stephanie can probably even speak to this more specifically, is when OCI and DHS are involved, or when any state agency is involved, the notion of being really transparent about that government agency involvement, we've heard very specifically in feedback, is really important. So that if the government's involved, the government needs to sort of be forthcoming that it's there. But I think that those points are so important when it comes to making sure that the messaging is coming from community organizations and advocacy organizations and so many other places as well, and is owned in that capacity, and understanding that message may vary when it comes from various organizations too. There's obviously so much validity and importance to the notion of having that broader statewide message, but to Allison's point, so much of it just is sort of continuing to bring different voices and different organizations to the table and doing that work nonstop. Everyone on this group has a really hard job and requires basically nonstop work. And so I just want to point that out, that I think sort of many tiers that are a part of this conversation.
And I didn't mean it to suggest that I don't think the state's name should be on these messages, just that to do focus groups and to do testing of the messaging that you send out, or that, you plan, rather than just being, within this group or within groups at state agencies to be like, yeah, we think this is a really great message. Doing testing with an actual focus group of people you're trying to reach can be very enlightening. And I've learned a lot about that from covering Wisconsin messages that I may think are compelling are not necessarily the messages that are compelling to the audiences that we're targeting.
And I'll just say that when Olivia and Rebecca did, it was a Facebook Live event, I was astounded by the comments that were specifically directed towards DHS. And it wasn't about Medicaid, it was just DHS and sort of like, this is the face of the organization I'm angry with right now. So, and that was because of the, like safer at home order. And so all of those things are really, really important as we consider messaging and where the messaging is coming from. Validity, yes, we need it to be an organization that seems valid and trustworthy, but also we really need to like consider, is this an organization that people are angry with right now? How is this message going to be perceived just because of where it's coming from? We don't want it to not be listened to because of some perceived wrongdoing.
This is not an either or, but a but, or how do you say that? But a and, both and?
A yes and.
Yes and, I don't know. Comment. One of the reasons that I'm very interested in having kind of the official imprimatur associated with that kind of a clear, unified message is because of all the different things out there that present themselves as health insurance and as health insurance options, and all the confusing messages that are out there for people about what they should and shouldn't be doing. And so while I don't disagree with anything that has been said here around, issues of trust and, anger at the state or what have you, and, I think that's all extremely valid. I also am very concerned, as I know you all are as well, that there's a lot of bad actors out there in terms of what the kinds of products that are being sold and promoted to people, or maybe not even bad actors, but people with different motivations or different value sets around things that, excuse me, are being promoted and sold to people who are in vulnerable circumstances. And so that's why I think it's very important for there to be some kind of clear quality control and to kind of clear up the cacophony of messages that people have been exposed to over these last 7 years. Because every single advocacy group and the state have all been speaking individually to consumers. And that's kind of what I'm interested in trying to move toward in some way.
I totally agree with that, Donna.
I would just say too that under the under our agenda item of the role of the work groups, I think that has been such an amazing value for all of us to have this platform where we come together and talk about these issues. The short reports that we did today don't really even skim the surface of the deeper conversations we've been having about what is getting in our way of promoting coverage in Wisconsin and the learnings we've been able to do from each other. And so I guess I just didn't want that point to be missed about how important this platform has been for all of us.
Yes, Melissa, and I would also add if there are members of the advisory council that want to get involved in a work group, let us know, because we definitely value the input. We have a broad group of folks that are part of our work groups, but we're always looking for additional ideas and inputs and trying to make it even stronger.
All right, thank you, everyone. Just trying to be mindful of everyone's time here. I think we should move into the open enrollment discussion. Allison, if you could give us the overview and goals, that would be great.
Yeah.
Thank you.
So, so much of what I think I would want to touch on has already been touched on to some extent. Is just, this recognition that this group especially came together around open enrollment. Obviously, other issues made it so important to just focus on what are the needs right now. I mean, and to not dismiss, though, that enrollment year-round happens every year. That's something that we're always working on, that Medicaid enrollment is happening every year, all the time, and then trying to raise awareness about that, trying to raise awareness about SCP opportunities. I was looking back at some of the data that Covering Wisconsin has over the past few years and just looking at open enrollment versus non-open enrollment timeframes. And, really, at least according to our data, we have enrollments, probably half to maybe even 2/3 of our enrollments happen in the non-open enrollment time period. So I think, just thinking about this whole, what are we leading up to right now for open enrollment? What have we been working on, and how do these two things come together? Do we try to separate them, or do we try to just acknowledge that it's just kind of keep rolling? We haven't stopped and we're going to keep going. That said, we do also know that marketplace open enrollment has always been that time that folks who are Medicaid or Badger Care eligible suddenly become aware that they have a health coverage option. They may think it's marketplace, or maybe not, maybe they have no idea. But then we realize that going through the enrollment process that in fact they are Medicaid eligible. And so marketplace open enrollment, highlighting that is still really critical. And I think we're gonna find that a lot of folks, we are seeing that trickling in, especially of Medicaid enrollments, but we're gonna start seeing, I think, a lot more folks being aware of open enrollment. There's this opportunity, oh, I need coverage. Going in, and many of them may actually be in fact eligible for Medicaid. So, thinking about that larger picture, thinking about what we as a collective can do to ramp up for that and to make it really effective. I think about it is kind of a AAA campaign. You have awareness, making people sure they're aware that this is happening, that there's options, that the ACA still exists. Accessibility, we touched on this a little bit in terms of the capacity group. How do we, in WIS covered, how do we actually get people from the point of, oh, there's this thing out there. How do I actually get to it? How do I enroll on my own if I feel like I can do that? Or how do I find help? And then just again, still acknowledging like, this is all year. This is not just open enrollment. You may still have opportunities even if it doesn't happen during open enrollment. I think for, this has also been touched on in this group, the three main actions for each of you to recognize that we can even further ramp up together and to really make this effective is having representation for your agency on the work groups. Doesn't have to be every work group, can be just one. That's totally fine. Obviously, these work groups work in conjunction with one another. They're each doing such important work. The second is this promotions campaign that Stephanie and Olivia mentioned. It's an opportunity to both influence that, but also say, how can we contribute to making this statewide, to really trying to reach people? And each agency, it is so important for you individually to be doing your own work, to be reaching your community. Like we said, you can't do too much messaging. You can only do too little, probably. That it takes so many times to hear a message before you actually take action, and to hear it from very different places. You never know which one is going to resonate, which one's going to stick. And then the last piece is making sure that we know and somebody knows how to access you. So we've talked about okay, using 211 and referencing that. But one of the things that 211 uses is the connector tool. And it's just one piece of the bigger puzzle. And it's a piece that, at least covering Wisconsin, has been working towards. We've been working on it within the capacity work group as well. How can we improve this? And basically this tool is a place for anybody to put in their zip code to find assistance that's local to them. And you might say, well, local assistance right now doesn't really matter. Everybody's just, inside or, using phone appointments. Yes and no. It's still so important. We know that just like with community organizations doing their own promotions, that local connection, knowing the environment, knowing the community, knowing the resources, knowing the health plans, it matters. It can make a difference. If there isn't that local connection, there are other resources in the state to be connected to. But we've been working very hard to make sure, can we find other assistance in the state that needs to be in there? It's got a lot. It could always be better. And so it's just in summary, it's somebody who is an enrollment assister who serves anybody, not just internal members, but the public if somebody were to call you at no cost to the consumer, and does both Marketplace and Medicaid. There's a little bit more nuance to that. We have a attestation screener and everything that we've created as part of this. But it's a way of just, again, making sure that you are counted and you're available as a resource. So again, just being connected on these work groups, being a part of that, helping out with the promotions campaign, and then somehow being connected either on the connector or just somehow making sure that you are known as a resource. The connector is the easiest way to do that. I think as this advisory council continues to talk, and perhaps we can broaden that even more, because I think there is some capacity that could be included that isn't currently. But I think those are the easiest things to make sure that we are working even more in coordination. So I know that there's another bullet on here about the earned media and outreach strategy. I know that Stephanie, Olivia, you talked a little bit about that already. I don't know if there's more that you wanted to talk about.
This is Olivia. I don't know if Stephanie has something to jump in with. I would just say, I know that the marketing work group, and I'll say if Kelsey has anything to add, since she's OCI's lead now on the work group, that they're working to put together materials that can be shared with the larger group, and that folks can participate in. That's the only addition that I sort of wanted to note, and then I know that is forthcoming. But I will turn that over to Stephanie and Kelsey.
I don't know about OCI. I will say that we have been working really hard right now to try to get some earned media, and part of that strategy has been investing in paid interviews. Sometimes that's a way that people will notice, but the old days of press releases, we haven't been able to get any traction there. I know that when the press release comes from the governor's office, it gets a lot more traction than when it comes from a small nonprofit or an agency that most people are just not familiar with. So there are some challenges inherent in earned media, and so something the work group can really think about and strategize about is what are some of these ways that we can capture earned media, and maybe the best way is press releases from large government entities that garner a lot of interest.
One thing that I would add is, we've tried to push out a lot of content through our COVID series, our COVID webpage, and I think it would be, we can do something for open enrollment too, but we have a YouTube channel that gets quite a bit of traction. I think we pushed out 40 to 50 videos. We had 5,000 or 6,000 hours of viewing on some of those. So there's an opportunity there. We have an FPL calculator that we use that allows people to go in and identify what their federal poverty limit is for last year for Marketplace or this year for Medicaid. Those are really helpful tools, and they're magnets for people that are looking for information and getting directed elsewhere. So some of those are opportunities, I think, that as we pivot towards open enrollment, we'll be activating some of those networks. But just, you know, I mean, we've got a saying that, it's an old saying that everyone knows, but perfect is the enemy of good. I mean, we used to do videos in our studio at our office and have our camera production and our backdrops. Now it's a cell phone video that we're pushing out the content. We're still getting a lot of views. We're still getting a lot of hits. And so I think it's important to make sure that that effort is there. We're putting out, you know, of course, accurate and timely content. I mean, there's nothing worse than, you know, bad is the enemy of good too. So if you start putting out bad content that's inaccurate, that's not, you know, getting the right message out, it's going to be inconsistent with what we're doing. I think the important part is that we're all, you know, trying to do our best during this upcoming open enrollment period to get as much information out to as many people. Again, like I said, repetition reinforcement is going to be part of the key, but, you know, accurate and timely information as well.
Stephanie, on the point of sort of agency participation as it relates specifically to the earned media initiatives, I would say absolutely. I've been very much in sort of listen mode and learning mode, and bringing myself back up to speed with the incredible work that this group has been carrying forward. And I know there's been some engagement from DHS, and probably certainly not as much as we had hoped pre-COVID, as we've had to redeploy a lot of folks to that unique response effort. And so I appreciate that it's moved, that the work has continued to move forward, but also what part of what we've been really trying to do throughout the course of our response is build additional capacity so that we can continue to do what we need to respond to COVID, while also keeping our eye on the ball and moving forward the many additional priorities that exist across the agency. And so I think you will soon see our ability to better engage and participate in the various work groups. We've got, and I don't know if you wanted to speak very briefly to the restructure within the Division of Medicaid Service, but I'll say as of Friday, we have hired a new director to as part of our COVID response, and we're wrapping up our deputy director interviews right now, which again, less directly relevant to this group, but I name it to say, again, part of what we're really trying to do is build the capacity that we need across the agency to walk and chew gum and manage the many priorities that exist. And so thanks for continuing to move things forward while we've needed to have an acute focus on the response. But I've got lots of notes here as part of this discussion about places where it seems like we can immediately re-engage, where we can think about how to work together to understand where it makes sense for agencies to lead out in front, to lead from behind, and to overall support the effort.
And I'll just say really quickly, our restructure is still underway, and there'll be more information coming out publicly about it fairly soon, within the next month or two. So, but just 4 quick lines about the key principles and goals for that restructure, which should be fairly seamless to those of you who are not inside. But we're aligning around a managed care model. We have a focus on holistic health and health outcomes for our members. It's going to be more person-centered care, which places the members at the center of our care model, and simple, intuitive, culturally competent programs which promote equity. So those are the principles around our restructure, but more information will be coming soon.
Great, thank you both for those updates. All right, we can move on to the consideration of the letter to HHS. I'm not sure if I need to pull that up. I'm hoping that everyone had reviewed it ahead of time.
Kelsey, would it be okay if I said a few words about this letter in particular?
Sure.
I really just want to, for folks who weren't engaged in some of the work group conversations, make a note sort of about the purpose of this letter. During some of the initial conversations around open enrollment, one of the things that was mentioned was, or the question that was brought up was whether or not there was going to be anything else done with regard to open enrollment to try to extend the opportunity for Wisconsin consumers to participate. Obviously, we didn't get a special enrollment period as it pertained to the pandemic. And because that is managed at a federal level, and the state doesn't have the ability to make that change on its own, and I apologize, my mask is being a little funny at the moment. Really, one of the questions that sort of came up was whether or not, as a collective group, with the number of participants who are here, if we could take action together to request, for example, that the federal government extend the open enrollment period, whether that starts earlier or goes later, to give consumers additional time to get that open enrollment work done so that they can get access to health insurance coverage. And so this letter was drafted with that input and by the team at OCI for consideration of the group. And I think Kelsey will walk you guys through sort of what the next steps are on that, but that's what the origination of this letter was for the group to consider today.
Thank you, Olivia. All right, I didn't, sorry. Would there be any more discussion, or should we move into a vote of sending it off to HHS or not?
And I think one of the things, Olivia, and I just was able to quickly look at the letter, and that I just wanted to, share. One of the things that we're experiencing among our navigators is that given that all of the enrollments are virtual, either over the phone or maybe in concert with some video support, they take longer. The appointments are taking longer than they typically do when they're in person. It's a lot harder to communicate, as I'm sure you all know, when you're over the phone or over the video with somebody. It just doesn't translate as well. Plus there's additional time that we take on the back end or on the front end, sharing information, sending information. And then finally, the last thing that we've been noticing over the past several years is if you look at marketplace enrollment data and over the weeks, that the vast majority of enrollments actually happen like that last week or the last 2 weeks of the open enrollment period. And so combine that with needing longer enrollment period, appointment times, there is a concern that will we be able to support everybody in the way that they need to be supported? And kind of also, I should say, the thing that I said earlier about there might be a lot of folks out there who are unenrolled, or excuse me, uninsured, see promotions for open enrollment, which would be awesome and exactly the intent, and only use that opportunity to start enrolling because they didn't realize they could actually try to enroll in Medicaid or SEP previously. And so just all of those things coming together, there is, I know at least at Covering Wisconsin, we do have quite a bit of concern that open enrollment is going to be, during that 6-week time frame, may be very, very challenging. So I wanted to share that context.
Question on the letter. I was curious to understand from the insurer partners on the line because I totally agree with you, Allison, and with the sort of the thinking behind an extension to the period, the time that it takes to really support people in making the choices that are most aligned with their healthcare needs. But I'm curious to understand, maybe for a minute, from one of the insurers on the line, just how you think about an extension, whether and how you what sort of lead up time you need to sort of plan for that.
So Lisa, it's Melissa, and I've talked this over with the folks at Common Ground, which, you know, there's a lot of ACA enrollment, and it used to be that open enrollment lasted past December 15th, and it's not really an administrative challenge for us, at least, to extend it, and I know that our company supports it. Obviously, the biggest challenge is effective dates for coverage, right? So maybe you miss that January 1 date, but I would agree with everyone else who spoke before that I think we all see this open enrollment as being extremely challenging when it comes to helping all the people who may be looking for coverage that don't have any familiarity with ACA coverage at all, and the tax credits and so on. So what's important to us is that we have the time to be able to spend with those individuals who need extra help, and that they don't end up having to forego coverage for the entire year just because they missed a deadline they didn't know about.
Thank you.
This is Donna, and not an insurer, obviously, but been around a while. I just want to say before the date ended at December 15th, it previously went into January, like well into January, I think to January 15th. And the first year, maybe even to January 30th or beyond
31st,
because of the glitches. Yeah. I definitely don't think an end date of December 31st or January 1st would be a particularly helpful thing given the holidays, and also speaking, and maybe Adam has something to say about this, about the severe burnout of the enrollment assisters during the 6-week period. And then having them have to do their very last crunch during the Christmas to New Year's week would probably not be a good thing. But I do think a longer open enrollment period. I know in previous years also there's been discussion about, and I know this clearly wouldn't happen this year, but about moving the open enrollment period to coincide with tax season. Other things that would improve the process, and who knows, honestly, you know, depending on what happens with the presidential election, there may very well be a nationwide SEP added in early 2021. We don't know, but I just want to note that if it's adding on an extra 2 weeks in the end of December, I'm not sure how beneficial that'll be from anyone's perspective.
Yeah, thanks, Donna. Even if you just negate, so yeah, there is a burnout factor for enrollment assisters that are doing, 6 weeks, especially if it's just 6 weeks, but 6 weeks of just fully on every day helping consumers the entire time. But even beyond that, and you touched on this just a little, Donna, those 2 weeks in particular, I don't think will be particularly useful because people's priorities will be completely different. They won't necessarily be thinking insurance. The holidays are a time when people don't, they want to be with their families. They want to disconnect from things that are stressful. So I don't know what kind of additional buy-in. Normally we get a crunch, the first week of December is kind of the highest enrollment, like right before it starts to end when people are really thinking about their insurance. I don't think we'll see that get shifted to if we're talking about the week of Christmas. So I agree. There is precedent that it used to go to January 31st, and I think that's what would be the most helpful. And then people would have plenty of time. And I think Melissa touched on start dates and things like that, but it can be done. Earlier, I don't see as an option just because OCI probably knows this well, but when the insurers have to submit their plans and they have to be reviewed by OCI, and I know October is very hectic. I doubt we could get earlier.
And this is Olivia. I do want to, those are really good points. I do want to make one note just for the purposes of this discussion, which is I don't believe that the letter specifically designates when the parties that would be signing it are asking that the enrollment period be specifically extended. It's more the request itself to HHS that there is a longer enrollment period in whatever way, potentially HHS might consider that. And so I think that that's just for the purposes of this discussion and for folks deciding whether or not they would like to participate in the letter is something to consider.
Thanks, Olivia. I was hunting for it right before because people started talking about it, and I wasn't sure if it was in there. I did not remember seeing it.
This is Melissa, and just 2 points on that subject. I think we should put a date in there to the end of January, which, I mean, I obviously I can't speak for other insurers, but we would support that. And, I think it is indicative that the insurance industry as a whole pretty much supported a SEP for ACA coverage. So I think that, the industry is willing to consider that extra work that goes along with adjusting our systems to be able to accommodate that. I think that that shows that. The second point I would make is once we finalize the letter, I would encourage all of us to think about ways that we might be able to promote it to our national organizations or to our colleagues in other states that we have connections to, because obviously we'll be more successful with HHS if we can build kind of a national movement here to ask for this. So we had brought this up with our national association, and a lot of issuers in other states, it was something they hadn't even considered yet. So I think that would be really helpful.
This is Mark Huth. I can't say it any better than Melissa or Donna or others, but I would agree as an insurer. I think extending the deadline makes a lot of sense, especially given what people will be facing this fall.
Thanks all for your thoughts on that.
Okay, thank you all for your input on the letter. I think we can go ahead and plan on recirculating an updated draft, and then we can go ahead and maybe vote via email as well for that.
Kelsey, it's Derek.
Yep.
Actually, never mind. Sorry.
Okay. All right, so for the next council meeting, we're planning on something in the second week of October. So if you just make a note of that right now, I'm gonna hopefully get a date secured here pretty quickly and get that sent out to the whole council. So I know we're a little bit past time here. We are recording the session, and I did plan on sending out some meeting minutes afterwards as well, so I'll get that out to the entire group. So not sure if anyone has anything else to add.
Really appreciate everyone, and thanks Kelsey for leading us through the agenda today, and to all the team members who continue to put in just an incredible effort. Thank you all.
Thank you.
Thank you.
Thanks. Bye, everybody.
Everybody.
Bye.
Thanks, folks.